So let's begin. I'm going to be sharing my slides with you now. Do let me know if uh, no ground rules here, which are different, just the same. If you want to get onto any, you want to take a break in between, go ahead and do that. I will leave the last 15 to 20 minutes for any question and answers. And try in between, if you do have a question and it's an important one, do raise your hand. Or if I can't see your name, maybe Ian can guide me there. That's about our basic housekeeping rules. Welcome to the session today. Do you see my slide there?
Yeah.
So today we're going to be talking about how we're actually trying to come out of lockdown safely. I will be sharing these slides as well as let you know where the actual document is on our website, the link to it. We have additional information beyond the toolkit, which is also there on the toolkit hub. There's some information specific for the Ealing borough, which is recorded separately, and there's some for Hounslow, which you would see later. I'll come to it later. What is the contents of this toolkit today? So the toolkit, when you're looking at it, you will see quite a few links to the central government websites, the health and safety executive websites and trade unions. I have gone ahead and tried to check if they've come up with any more updated links, but I didn't find any post this recent change made by Boris, our Prime Minister. But so most of them were created at the beginning of spring. We have a range of templates, some with examples and some just giving you an outline of the policy that you should have in place before and even if you've already started to put these into practice, which will help you meet all the guidelines. We'll be talking a bit about risk assessments, and that's also there in the toolkit. What you need to look at, what you need to keep an eye out for. And in the past, we've been assessing the risk of our organizations, but COVID has we have had to look at it completely differently now. So the new kind of assessments that we'll be looking at. And like I mentioned at the beginning, not when everyone was here, we'd like you to keep an update, or keep up to date with the changing guidelines. Right now, we have the information that's present, but to keep your eyes open for any further changes. We'd like you to also connect with your peer networks. This would help you to benchmark against the other organizations working with similar in a similar situation as you. So a lot of networking forums should be a good place for you to start, and get to know what your peers are doing. In terms of advice, we've got government advice, we've got health and safety executive advice, we've got the NHS England advice, and we've got NCVO advice. All these are there in the toolkit with the links, which you can click on. I will go through the toolkit with you later to show you where it is. Additional information that I have put on, just to give you an idea, is how you would support your staff. If you click on the link there, which I've put on, which is working with your staff, it would talk about various areas of how you can support your staff working from home, the tax benefit implications, if your staff is not working from home and at your office, how you would support them there, those who are clinically vulnerable, any those self-isolating, exposure to sick pay, how you would give, how you'd look at that, or furlough, annual leave, and things like that. How volunteers can best be engaged and supported during COVID pandemic. This link would give you information on how you would plan for the volunteering roles now with the pandemic in place, or the virus is not completely gone. So what's the new insurance that you would be providing? How would you plan for furlough? Or if at all you have excessive volunteers coming to you, redirecting this to organizations who would need them, uh, and also basic safety of your volunteers. So there's more information in there, but I'm just giving you a bit of an overview. Uh, the other area that which I've identified here, which I think we need to look at, is what charities and formal voluntary organizations need to consider in meeting their safeguarding duties during the COVID-19 pandemic. A lot of our meetings are happening online. A lot of our events, a lot of our programs are happening, are being conducted online. So how we are managing this risk, what kind of activities are you organizing, and are they safe? Are you meeting with all your safeguarding? Because that's a primary requirement of every organization. How you're managing your finances and supporting your beneficiaries. Uh, Information on finding sources of funding and how to plan and carry out fundraising during COVID-19. Again, yeah, this link would give you information on the government support, given to you, or what are the pots of funding given by the government, uh, by the government. So it would give you resources to that. The key things trustees need to consider in governance of their voluntary organization in light of COVID-19 pandemic. Uh, this link, which I put in, these are your additional links beyond the toolkit. This would talk about how you run your meetings. How many people can you have at your meeting? If you're postponing your meeting or canceling your meeting, what's the procedure you would use there? What are your duties of your trustee with these new uh, the new guidelines in place, or any serious incident that's happened, how you could manage your board dynamics and things like that. So very, very detailed information on these links, which you can have a good read on, and keep your eyes, keep yourself aware of things. Our toolkit, coming back to our toolkit, it would give you links to check the government closure guidance as of now. It'll also give you sector specific guidance, so links on that. What I'm going to be reading out here is, I'll get into details in a few minutes once I show you the toolkit. The insurance, which is another big area that you need to look at. How you would check with your funders and commissioners if there's any changes in the way you've been running your activities now. So what you would need to, what are the questions, or what do you need to get back to your funders about? The assessment, COVID-19 assessment that you need to do in terms of staffing, in terms of your building, the services you provide, your PPE, and how you travel to work. Guidance, links to the specific areas are what we've collated and put down in our document. How your frontline staff, getting them tested regularly, links to where it is available and things like that. Getting your risk assessment approved by your trustees. So you would have had your policies in place, which have maybe a 2-year or 3-year update. But now that you'd be creating new policies, you would need to get these updated. If you need any further support on your policies, Ian and I are happy to help you post this event. We can have a one-to-one and discuss the policies with you, but you need to get that brainstorming done within your organization and understand what is your specific risk in your organization, and with the new restrictions in place, how does it affect you? Understand your legal reporting requirements, And there is also some links on high-level plans. I have put down some templates, which would be, some are just templates and some are with examples. So you have your staff risk assessment template, which is an example. You have your building risk assessment example template. You have your workplace risk assessment example template. And you've got one of them, which is completed. Sorry, is there a question? So we've got some of these templates with examples which are filled in, which will help you create your own. Finally, the document also talks about different kinds of risk levels, you know, where you can, how you can grade your assessment. And I'll take you through establishing the high-level roadmap and the service activity planning template. I'll show you those in the document. I didn't want to add it in the presentation. So coming to where this document is, I have one which is the Hounslow CVS toolkit, and one which we have set up for the Ealing Hub. So I'll click one of them because the document that we're talking about today is same for both, but we've just got some additional information which was recently updated for the Ealing group. So this is where, sorry about that. This is where the link will take you to. We've got various training resources and things like that. But what we need you to do is go to toolkits. Okay, I'll just go to the toolkit. So this is the toolkit which we've created. This is the document that we are talking about, the recovery planning toolkit. This has got all your risk assessment, your templates in this particular document. In addition, what I've done is I've added, Ian and myself, we've added COVID secure workplace. This is guidelines by the health and safety executive. The guidance is available here. It's pretty detailed. You've got the government guidelines, which is separate for businesses and self-employed people. And you've got guidance for businesses in Ealing by the Ealing Council. So this is not something we're going to go into today, but this is something you can go in and, you know, explore further. I will show you the toolkit that we've prepared for you. So this is the recovery toolkit that I was talking about. Any questions so far?
Could I just ask, are you emailing us or giving us the link to, so that we can, to these two documents that we can download ourselves?
Yes, Mary, I would be sending out all this, the presentation and the links and the tool, where the toolkit is to you.
Brilliant.
So, you know, you can then go through it because it's just not possible for me to go through each link.
No, that was just to double check we were getting the link. Okay, thank you.
You're welcome. So this is what you can just, you know, control and select any area that you need to quickly browse through. This is just an overview of the recovery toolkit that what I discussed, what is in this toolkit. So all those important information, the government advice that I was talking about, all the links are mentioned here. And you know, what are the different areas that you should be looking at. I would encourage you to go through each link at you know, a leisure time, because it's all important. So going through it once would give you an idea of what updates to look for. There are links to the health and safety executive. The updates from the health and safety team, the NHS and NCBO. These are also supplementary to the government advice, and this would help us, you know, getting safely back. So you're not you're in a good place and you have everything set up before you restart. This is what you would need to look at just before you get in any further updates in terms of closure guidance, sector specific, as I mentioned, your insurance company and checking with your funders. I've already discussed this earlier. These are your templates. This is why I opened the document to show you. So this is how your risk assessment, your staff risk assessment template would look like. We've broken it down into different templates, only so you can actually have a look at how it is, you know, what are the areas that you need to focus on. So this would make it easier for you to plan. This is another one on your building risk assessment template. So you have your grades down there, high, medium, and low, which would help you identify which risk and how much focus you would need to, you know, pay to each particular risk. This one's your workplace risk assessment. So again, another template on that. And this is an example. So this is one which has already been filled in. And more information, these links would give you more information on, you know, this is connected with what the government guidelines are. So this is just a completed example of one of the templates, or any additional information that you think is specific to your organization. You should go ahead and add it to these, but the ones that are already there, if it is, it's just, if your organization works along, you know, dealing with children or frontline, then these are some things that you need to have in place on your policy document and looked at. This is for office-based employees. What's the kind of guidelines that you need to look at? Finally, additional government guidance that I mentioned earlier, you know, in terms of PPE or social distancing, those are in place there. Still with the templates. So I'm going to quickly rush through these. This is another one, which is your office works and general field work outside the office, another template on that. So we've tried to see, this one is with an example, so give you an understanding of how you would need to create your own. Now, this is what we're talking about, is the establishing the high level roadmap. Different areas or aspects, it's set up to identify the operations, how they will look like, what is your risk level at different, you know, times, how you would analyze your business if it is running as usual, or you need to make sudden changes if there is some kind of guidance which has come in, or if you need to stop it. So what effect will it take on each area of your business, and what kind of risk would you assess to each of those operations? First, identifying the areas of your operations that would be affected, and then grading it as per severity would be something that, you know, you could go back to if it does happen. So having this on hand, you know, discussing this at your meetings, getting your trustees to accept it and approve it is something that you need to look at. And your service activity planning template in terms of staffing, building, equipment, etc. So a lot of this document talks about risk analysis, and that's what I'm going to stop sharing here. That's what we aim to promote in this training session today, how important it is to actually analyze the work you're doing, being prepared for, anything, because we've never really prepared for COVID before this. We've just looked at, small areas that we'd, any kind of small contingencies, but this is something that we really need to look at, because you don't know how long it's going to last and if this is the way forward. So happy to share all the documents with you, information with you, post this session. And if you have any questions, I hope I wasn't too fast and you're able to capture something of what I said, but don't worry if you haven't. The recording is there, and the document is very extensive. The toolkits that both Ian and I have created for both Ealing and Hounslow are like a one place to look at if you need any kind of advice on a one-to-one area. Feel free to call us, or email us, and we'll set a time for a call. A lot of serious faces. I hope it was helpful.
I'd like to see read the document first before really thinking about questions. You skip, you get a good overview, but it's not really very detailed. So until dug into it a bit further, it's difficult to know what questions to ask.
Yeah, I couldn't really get through to getting into details of the
I appreciate that. Yeah, I realized that.
Yeah, I realized it was such a huge topic and couldn't be covered, unless we have a long session, because it's important stuff, and it's stuff that you need to go through in details.
I think sorry. No, continue, Edward.
I was just going to say, obviously, parts of it are more relevant to a particular organisation than other parts. So you've got to decide which bits to dig into.
Yeah, so we've tried to cover maximum number of areas.
Yeah.
But like I said, having networks with people, who, having similar operations does help you understand what they've put in place, and with the latest guidelines, and just keeping yourself informed does help you plan better. So
absolutely.
It's good to have like a little book that you could go to, or your policies in place, but some of these are important documents you need to have, like you would need to have a risk assessment policy. So you need to update it now with the COVID-19 strategies or plans that you have in place for handling issues if we are hit by again another lockdown. Hopefully not. Hope we'll be able to tackle it down and get out into safely back to close to normal situations. Ian, would you like to add anything here?
I'll just say, it's good practice to have a risk register anyway, and to update it on an annual basis. But obviously COVID has just made everything a lot more complicated, because the COVID guidelines are sort of constantly changing. So that's a whole sort of massive risk area in itself. So it's just kind of building on what was already really good practice. We just have a risk register anyway, identifying your likely risks, be it premises, operational, financial. But COVID, like I said, has just made things a lot more complicated. And obviously this is right as we're coming out of COVID, hopefully into more recovery phase. It should sort of settle down a bit, and obviously this toolkit will help you to sort of help you to do that.
Can I just ask? I mean, I'm kind of conscious. I know everything's got delayed again by another month, but it was suggesting that kind of after at the end of stage 4, we'll all be free to do what we like. But obviously, I'm not particularly keen on opening everything up and not putting anything in place. Are we able legally to put in place requirements that we may have? So things that we're putting in place or thinking about putting in place now around, distance between people if they're in the office, ventilation, wearing face masks, all of those kind of things. If they're not required as kind of, you know, guidance from the government? Can we still do those things when stuff opens up?
I think it's a good practice to do it, because the guidance right now is changing, and it's changing at every point depending on the spike in cases. But just as a safety measure, having those things in place and preparing yourself, you know, is more a responsible approach. So I think, yeah, we should be the basic guidelines of
I mean, I think it's up to each organisation to obviously implement their own safeguarding processes, procedures, obviously as far as possible, following the guidelines from the government. Sorry, but I know there's lots of organisations are looking at how they're going to go back, because they're more of a sort of blended model of having some online, because obviously you can't force people to come back to real life events. So you're still going to have people who want to work, you know, go to meetings, access meetings from home and stuff like that. So I think it's yeah, it's up to each organisation, I think, to follow its own processes and decide how it wants to.
I suppose also I'm thinking about those people who, I mean, yeah, we're very we're not expecting people to come and be based back in an office if they don't wish to. We'll have remote working for as long as people want to do that. I suppose it's partly the people who do want to come back into an office, and if the guidance is I suppose more lax than we would like, it's a bit like, you know, wearing face masks, for example. If the guidance says you don't have to wear face masks, but we'd like to implement that as an organisation, but we've got members of staff who say, well, you know, the government's not saying you've got to wear a face mask indoors. I suppose it's just that where we stand in terms of having requirements that are maybe above what the guidance talks about.
Yeah, I mean, I'm pretty sure that, you know, you'd have that leeway to implement it in a sort of tailored way to how you organisations want to work. But obviously there are probably other sources of advice where you can get guidance. I mean, I think, you know, like I said, the government guidance is constantly
changing,
constantly evolving. I mean, we are hoping to have a session later in the year about how we sort of create this hybrid model with an external organisation which is going to deliver training for us. So obviously when that is available, we'll promote it. But I think at the moment, obviously, you know, I hear from other organisations they have, every organisation has its own, you know, risk analysis it has to do. So it's I don't think there's any kind of like blanket approach. I think it's just evolving to sort of see how this new blended approach, as they call it, between sort of a lot more home working and remote working and sort of office working is actually gonna work out.
I mean, certainly with our actual services which go into people's own homes, I mean, it's been quite helpful them coming out with guidance now around vaccination, and people, frontline care workers, for example, working in residential care homes, and the discussion around making that compulsory, because that was one of the things that we were thinking about as well, you know, wanting to ensure that maybe our volunteers who are going into people's houses have had 2 vaccinations as part of our policy on that. But, you know, while you know that staff working within a hospital or something aren't required to do that, again, it feels a little bit difficult in terms of us putting those requirements when you know, other organisations and some statutory organisations aren't doing that. So I guess it's just, you know, just weighing those things up and knowing what we can or can't do.
Yeah, I mean, there is the Ealing, maybe a law centre. I mean, I know there's no CAB in Ealing, but I'm just thinking in terms of employment law. And we are having some employment law sessions coming up, so it might be worth attending some of those.
Yeah, thank you.
We have one of our trustees is actually an employment solicitor, and he's going to do some sessions for us. So it might be a good one to come along there and just clarify with him in terms of what you can do, you know, legally.
Thank you.
Also, that, like you mentioned, Denise, every organization and the way you work is so different from the others. and your risk analysis. I mean, only you would really understand the actual support that you're giving, and the what would you say, the risk it is to you and to the person that you're providing the service to. So yeah, I do understand there's a very narrow area of a gray area of whether you need to go a little beyond what your competitors or your other organizations offering the similar kind of services, whether you need to go above the government guidelines. But again, it's at the end of the day, I think it also boils down to the risk to you and the risk to the people that you're providing that service to. So
also, I'm sure that Denise, that as the government guidelines came in on the care home staff yesterday, I'm sure that's going to be extended to other organisations, and that will seem reasonable. In fact, I was emailing my family this morning about that very situation, because they live in Cheshire East and they're in their 80s but at home, and I was saying, you know, at present they would put on hold having anybody round to the house because to allow the chance for further vaccinate. And I very much hope that it will be rolled out to, and I'm sure that it will, and that will seem reasonable and responsible within that workplace. But I do think as the guidelines for the sort of general working public, like within an office where you're not going into somebody's home, then I think that would be more open, whereas I'm sure people still individually can wear masks if they wish and have a sensible working space. But then there will be lots of people who feel that, like every day, you know, it will not be necessary if you're fully vaccinated and not with symptoms to go about work. And, you know, and again, you know, for instance, if people can actually hear what you're saying, or if you need to work in close proximity, and it would just be different matters.
Yeah, like you mentioned, there's a difference of opinion here when there's not a definite guideline to say this is what you need to do, but there is ways to interpret that particular guideline. And again, like Mary mentioned, if I'm doubly vaccinated, I've taken both my vaccines, which I have, sometimes you can get complacent and say, you know what, I don't think it's going to hit me, I'm safe. And then you tend to feel that, you know, you don't want to put on that mask. But again, we need to watch out for what's happening and the new viruses that, you know, the change in the virus that's happening, and it can still affect you after the second vaccine, maybe not to you know, as powerful as it is, but in some form. So yeah, let's keep an eye open for what the government guidelines is, but it's always a good practice to have your as an organization having your policies in place, how to deal with things, how to safely get out. So if we would be free, as Denise said, in a month's time, looking forward to positively opening up and getting back to work and making the most of the services that we're here to offer.
I think the top line document that you showed is really helpful, actually, because certainly we're thinking a lot about you know, what we do. We're trying to future-proof things, so we've got plans. We're talking through plans that we will have, you know, for in the instance of another variant coming in, for example, or
Yeah.
you know, if rates were particularly high, or if we found that, you know, vaccines weren't working as well for a variant that came in, or there were particular outbreaks or whatever, and just thinking about having that sort of top line about what we do with our individual services and planning ahead. Because I guess when COVID first hit, we couldn't have envisaged it, so we didn't really know. But having locked down a couple of times now and kind of understanding that, it's really helpful to have that kind of document for us to use to work through, and thinking of the different eventualities that might happen and that we can predict a little bit better now.
Yeah, I think what the document, I know I didn't go into each detail, but when you do have access to it and you've had that time, like Edward mentioned, going into it completely, it talks about different areas. What would be a trustee's role, or what should a trustee do? And also the additional links that I've put in terms of information that I've pulled out from NCVO. Those are very, very useful links to have a little read about it. It's not really long. If you could click on those links, have a bit of, a read on, it just gives you a better way to plan, it gives you a better idea on how to go about it, and areas that you wouldn't have otherwise, you would have overlooked. So yeah, we've just tried to pull that all down and introduce it to you. If you need any further support, you feel that there's some more help that you need in a particular area, then we're happy to go through with that again. Any other questions from Lisa? Or just give me 1 second to plug that laptop. Hi Lisa, good morning.
No,
It's Galaxy S8, sorry.
No, I have not got any questions. As I think as Edward said, I will just go through and look at all the documents and make sure any of mine are missing. But I regularly go through mine and update mine anyway. And my policies and procedures and risk assessments, they're on my website. That one of our digital capacity champions did my website. And yeah, and they're like regularly updated, and because we're different sites, I have to have a risk assessment done on the different sites.
Yes.
And so, and the COVID protocols, and we have like a set timetable of, because we have different groups going in, and we have a set amount of time gap between one group coming in and the next group coming out. And we have a COVID lead officer, we have liaison officers, we have COVID volunteers. So that's from our governing body guidelines, and we have to go to those. Well, we don't have to, but we go to those regular meetings as well. So, and I think I'm going to start saying that the coaches and teachers do flow tests twice a week. I think I've just thought of that because I've just done one, and I think that might be a good idea.
Those are brilliant. That's a brilliant sharing there, Lisa. A lot of points there, which I think are also useful to all of us here. Having these specific roles created. If you have additional staff looking at different areas, that's really useful. I don't know who's listening to us, who's Galaxy S8. And Joy and Natasha, if do you have any questions for us today? Okay,
no questions.
I don't want to put you in a spot, sorry. Joy, hi Joy.
No, I don't have any questions, thank you.
Okay, I'm going to be putting in a link right now in our chat, and I'd like you to click on that link and just let me know about this session. I know it wasn't detailed, but how you felt about the session and where's the additional support you need. It would take you a couple of minutes, but if you could do it before we end the session today, it'd be useful to me to, get prepared better or get more informative sessions for you. So please click that link there in the chat box and give me your valuable feedback. We're having another session at 12 o'clock. This is for organizations supporting Ealing service users. It's a Meet the Funder workshop, the Ealing Small Grant Workshop. It's the 2 funding pots. So do come and join us if you want to know more, and post the session, once you've had your say and asked your questions to the funder directly, which we've tried to make possible. We're happy to have one-to-one sessions. We can look at your applications with and give you any support you need there, some fresh eyes on your application, and any kind of additions that you would need there. So the session is at 12 o'clock. If you need the link, send me an email if you haven't already registered.
Thank you.
Thank you so much for your time today. And thank you for joining me. And do come back to me if you still have any queries. Have a lovely day.
Right, thank you very much.
Nice meeting you all.
It's very interesting.
Thank you, Edward.